Is still there. Dr. Akkad, if you can hear me, I'm hoping that you can speak next. So Dr. Akkad is a very well-respected economist, but passionate about free markets and maybe not a fan of insurance. So Dr. Akkad, can you talk a little bit about your perspective on safety nets and insurance and the economics of healthcare? So thank you.
Thank you. Thank you for having me. Can you hear me? Okay. Just a clarification, I'm not an economist. I'm a physician. I have an interest in economics. But that's it's a good setup for me, Dan.
I'm an honorary economist.
Right. Okay. But I want to say, I learn a lot from economists, and we all have heard the the phrase "you should think like an economist." Each time we have the lay people have a certain opinion about something. The economist will tell us, you need to think like an economist. Well, I think that's important, but perhaps if there's a take-home lesson from my talk, take-home lesson is that I want to teach economists to think like a doctor, especially particularly healthcare economists. They need to think like a doctor. I think that's very important, and they need to think like a doctor ought to think about medicine, because unfortunately many doctors, for reasons that I think will become clear, and I'll get back to that maybe at the end of my talk, doctors have stopped thinking like doctors, and perhaps are swayed into thinking more like economists in a certain way. But my talk here, I want to make the point very clearly that it's going to be neither appealing to the red side nor to the blue side as far as health insurance is concerned. Because I think that health is an uninsurable good, and therefore the red side's conception of health insurance is not going to work, and the blue side's conception of health insurance is not going to work. I'll get to that in a moment. But when I say it's an uninsurable good and that health insurance cannot be, of course, you will tell me, look, there's health insurance all over the world. I mean, we have health insurance, whether it's, state-sponsored universal health insurance like in Canada, and it's been going on for decades and decades, and we have private insurance here. So what are you talking about, that it doesn't work? Of course, it works. So my point is that it doesn't work for two reasons. One, it contains the seeds of its own destruction, if you will, and perhaps if you look at it historically, you can see that. And the other thing is that it's not what it claims to be. It doesn't do what it claims to be, what health insurance claims to be. But before I get started, I want to clarify that there are two concepts when you talk about health insurance. There are two concepts that are, in terms of social institutions, they're kind of distinct. The one favored by the red side, if you will, perhaps, is the idea that health insurance is going to be ideally should be a private contractual agreement between private parties. So it may be an individual contracting with a private insurance company to indemnify the individual for the loss of health. So if there's a loss of health, then the insurance company will pay for the restoration of health. Or it can be an employer perhaps, but it's a sort of a private business contractual agreement that is done in the free market. And then the concept favored by the blue side views health insurance more in terms of a social program. It needs to be a subsidy to a certain group of people. And I think that has been mentioned by other speakers before, but I'll get to that shortly. That distinction, that those two concepts of health and the lack of distinction about it was made clear a couple of years ago. There was a Republican representative, Morris Brooks from Alabama, who made a statement. He said, people who take care of themselves should pay lower premiums. And that was his view of health insurance, which is what you would expect if you think about health insurance in a contractual agreement term as a risk mitigator for, in case of a catastrophic event. If you take care of yourself, you should pay for, lower premiums. Well, the blue side, heaped ridicule on him for holding that position, because to them, health insurance has to do, it doesn't fall in that category. It has to be a social program of some sort, a subsidy to the poor or to the sick, and we'll talk about that in a minute. So before we get started into health insurance, I mean, we have to recognize that if you look apart from health insurance, what is insurance? Well, insurance has to do with in if we think of private health insurance. So I'm going to now put on trial, if you will, the private concept of health insurance as a contractual agreement between an insurance company and a private person. Normally, insurance, when it works and in other settings, car insurance, life insurance, home insurance, all these other things, there's a distinction between the goods that are being insured, that are susceptible to being damaged, whether it's the car or the home or the life, right? The person being damaged completely so that they die. And then the person who gets indemnified. So the owner of the car or the owner of the home or the benefactor of the life insurance company, right? So there's a separation between the goods and the beneficiary. When you apply it to health, you realize is that the case or not? And it's kind of confusing, because if you apply it to health and you think of health as a private contractual agreement, meaning, let's say I purchase health insurance from a company, a private company, then what are the goods and how are the goods different from me, right? So am I like a machine and I have body parts, and if a part gets broken, then the insurance will pay for having the parts get fixed? Well, that seems to be the assumption, and I think it is the assumption under that construct or conception of health insurance, is that the beneficiary is distinct from the goods, which is the body, right? So it's kind of a mechanical. The body is like a machine, like a car, and it breaks down, and if it breaks down, then it gets fixed. And the beneficiary is the self, and maybe the self is a soul that inhabits that body or something like that. But that has to be the understanding if insurance is going to work the way other insurance goods work. But that, of course, is false, because we are not ghosts in a machine. We are our bodies. The body is me. There's no distinction. In a sense, there is a duality in human beings, and there's a mind, if you will. There's some kind of a duality, but at the end of the day, we're one thing. We're just one body. I am my body, and I cannot separate myself from the good that is being insured, right? So that's a very important distinction that makes health insurance very, very problematic, and in fact, inherently problematic. Health pertains to the whole thing of me. It doesn't pertain to just a part of me. It has, in fact, the etymology of health. Health comes from the Old English whole. Hail is in Old English. So health has to do with the whole enchilada, the whole person here, and not individual parts. Okay, that's one thing. And the other thing is we are all unhealthy, right? We're all defective at some level. We're constantly breaking down, and we're never. I mean, if health is, in a way, you can think of health perhaps as an ideal. Health would be is what I strive to be. It's how perfect I can be. How I can be myself in my full perfection. Well, that doesn't work. I mean, it doesn't happen. I'm always imperfect. I'm always fumbling, breaking. My back hurts right now. I have whatever it is. It doesn't work. So that when you think about it that way, it becomes a problem. And I hope you can see that. And the other thing is, because we are our bodies, diagnosing the question of diagnosing an illness, is very different from diagnosing a problem in a car, right? In a car, a diagnosis has to do with identifying the broken part, and in medical diagnosis, truly, when you think about it, I won't have time to get into this. It's very different. There's a superficial familiarity with that, but it's actually very different. So the bottom line is that the private insurer would have a very hard time, number one, verifying the claims that the goods are damaged, right? the way a private insurance could verify the claims that a car is damaged or that a home is damaged or that a person has died, right? If that person is the goods for life insurance, those are objectively verifiable claims. The insurer can send an appraiser to go and check it out, and then the beneficiary of the health insurance of the insurance policy can receive the compensation. In health insurance, that's not the case. There's no independent appraiser, because in the process of determining, I mean, who does the determination of what's wrong with the person? Well, it's the doctor. And it turns out that the doctor is going to be paid by the insurance company. So the insurance company would have a really hard time on their hands trying to make this work as a viable business. And of course, because the goods are the same thing as the person, the benefactor of the beneficiary of the policy, the insurer has a hard time also controlling the behavior of that person or making adjustments to the premiums based on the risk, that person engage. Because at the same time, well, if I'm a smoker, am I a smoker because of my soul deciding to smoke and my body being a mechanic separate from me, or am I a smoker because biologically I have some predisposition for? So you can see that all this gets very, very complicated, and an insurance would have an insurance company, a private insurance company, would have a real hard time making that work as a business proposition. So, but somehow it seems to be working, and I mean, to be working, so to speak. But if you look at insurance products right now, they introduce a concept that they call medical necessity. So what happens is that an insurance company will say, well, we will pay for medically necessary care, and they do that. They can claim to do that by relying on this notion, which is also flawed, the notion of the standard of care, as if there were such a thing. The standard of care is a bit of a legal fiction. But it uses, the insurance companies that work nowadays, try to use this concept of medical necessity. And if you try to look into this and apply it in real life example, for example, apply it to the case of a truck driver who has a slip disc and back pain with, severe back pain, and perhaps the doctor says they need surgery. Well, does the person need surgery or not? Well, that seems to be very difficult to determine with any kind of objectivity. And so the bottom line is that health insurance privately cannot work. And if it works, then it's going to be, it will have to drive, the cost won't be controlled, the premiums will have to rise. And what will happen is that the insurance company will have to control the doctor, and this is what happens, control the doctors and make the doctor be a subcontractor. I say that I'm running out of time here, so I won't have a chance to expand my critique to the blue side of health insurance as a subsidy, a social program. But the bottom line is that the problems that I've highlighted here remain when we think about the public sector. They remain there. The only thing that happens is that the costs get shifted and socialized to the community, to the public, to future generations, and so forth. So I stop here. So because I see that I'm out of time here. Thank you, Dan. That was
thanks, Dr. Accad. That was great. And for those of you that don't know, Dr. Accad has a very popular blog, I believe, Accad and Cow Report. Is that right?
That's a podcast. My blog is called alertandoriented.com.
Yes, okay.
Yeah, all right.
Well, you're not an economist, you're a cardiologist. You are very knowledgeable about free market principles and an advocate for that, I know. So I kind of bundled insurance with safety net because that's how people view it. And Dr. Accad made a case against, insurance. And certainly I think we've seen a lot of evidence and discussion about how it leads to increasing costs. And it's a problem having, third parties and surrogates acting on our behalf. But now, this is the broader discussion about safety net. I want to kind of return back to the concept of the Affordable Care Act, universal coverage.